This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 20 in a 58-part video series of the entire book. Please review our introductory video in our channel to get the background there. Part 20 goes into Chapter 5, Enzyme and Supplement section, subpart Vitamin C. Vitamin C is listed as value 2, an important ingredient or supplement for the purpose of treating heart failure. People have heard of many different claims for vitamin C. The Linus Pauling Institute even recommends 2,000 milligrams of vitamin C each day to prevent heart disease. Any quantity beyond 1,000 milligrams can have side effects, so it's best to break it up. If you're going to take 2,000, then break it up 4 times a day at 500 milligrams per dose. The recommended minimum is 250 milligrams 4 times per day as a minimum. A report in the American Heart Journal of 2011 covered a clinical study comparing the quantity of vitamin C in blood with the rate of heart failure in men and women. Yes, they actually determined how vitamin C would impact. For every 20 micromoles of vitamin C levels in the blood that increased, heart failure dropped by 9%. Well, this study included 9,187 men, 11,112 women, and they followed up for an average of 12.8 years. Dr. Enstrom at UCLA studied 11,000 subjects over 10 years. He found that those taking 300 milligrams of vitamin C each day reduced their risk of heart disease 50% in men and 40% in women. That's a huge reduction. So what does that mean to you? You need to take vitamin C to promote heart failure recovery. The American Heart Journal of October 2007 reported on a clinical trial by the Kobe University Graduate School of Medicine in Kobe, Japan. They tested class 2 heart failure patients using 2,000 milligrams of vitamin C transfused into the bloodstream through an IV, along with dobutamine. After the infusion, the average ejection fraction immediately increased 20%. Now, 20% ejection fraction increase is a huge number, dramatically reducing classes of heart failure. Now, vitamin C tablets can raise your blood serum, but you need to take it over several times a day because the kidneys do filter out excess vitamin C. For dosages, start at 250 milligrams 4 times a day. Before any blood tests, discontinue taking vitamin C because it can interfere with lab results. Also, vitamin C can influence your blood thinning levels, that is, blood thinner medications. So take the same amount every day so that when you go into your cardiologist's office for a prothrombin time check, a ProTime test, this test will then be adjusted to permit you to take the vitamin C without interfering with the medication. Aspirin can also lower vitamin C levels. People taking 2 aspirin tablets every 6 hours saw their vitamin C levels drop 50%. There is a debate that vitamin C may increase an incidence of kidney stones. It's been tracked down to individuals, primarily men, who urinate high levels of oxalic acid. So you can have your doctor check your oxalic acid levels. Excessive doses can cause diarrhea, extra urination, stomach cramps. Just stop taking the vitamin C and readjust your dosage to reduce the sensitivity. Vitamin C is so important for heart failure recovery. Going back to that information that it increases your ejection fraction, that means it increases the blood flow from the heart rather dramatically. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in print and Kindle editions, from the Apple iTunes Store as an iBooks, from eBay in print edition, and directly from the publisher Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just send a check for $24, which includes shipping. Thank you for listening.